Good afternoon. I hope everyone is still awake this afternoon. I'm Bruce. Welcome to Wealth in Wellness, the virtual extravaganza with PFP and T32. I'm very happy to be able to share with everyone this afternoon on dental wellness and how to achieve that for yourself and your family. Since this is a Chinese New Year, I would like to wish everyone joy and happiness in the family, peace and protection, especially during these times. Everyone must be able to eat well, 吃好了, and sleep well. So, 虎年大行好运. I'm 25 years as a GP in dentistry. I've been in this dental group and I have the privilege to take care of the young and the old and everyone in between. So let me take you through this journey where how we take care of my patients and our customers as they live through their life, they work, they play, and they live. And of course for children, how they grow and learn as well. So as I was saying, as dentists, we want to be able to achieve dental wellness for our patients, and they need to be able to smile with confidence. They need to be able to eat well, sleep well, and of course for children, grow well. Let me take you through this journey. When you are infants or a baby, that's the only time in your life where you look cute, toothless. All right? As you become a senior, as I call them, the goldies, we try not to live or go to bed with our teeth in a cup in another room. All right? So over the next 30 minutes, I will bring you through the various challenges or cases that my patients come in and how we take care of them to help them achieve the dental wellness. So let's start off with the cuties. All right? These are our important part of our family, the young ones. At T32, we have a T32 Junior Oral Health Program, which we designed to make sure that they have a great first experience. And the first experience counts. We stress a lot in the education and the learning part for these young children. We stress on early prevention, early detection, intervention, and also importantly, ownership in the child and also by the parents. So as you can see, we set up our clinic very children-centric, and we have videos for training to teach the children how to brush. We involve them as they come to the clinic, all right? So they get a good experience. This is, by the way, is our Dr. Jia. She's our child specialist, okay? In our program, we go through a very structured series where toddlers, preschoolers of different ages, we stress to them and we educate parents and the children on what to do at various stages in their lives. So this is almost like a dental health book that we give to every child. And we share with them and they learn together with us what is important for them, to how to take care of them and how they take care of their pearly whites, all right? So we involve them. We educate them, and so there's ownership over time. We even have a education cartoon, if you call it, so that children will understand as they go through the experience with their first experience at the dental clinic. It's not so stressful. They learn as they experience the visit to the dentist with their family. And the family members, the parents, know how to educate them and prepare them for their visits. Right? However, I would like to spend some time to talk about the growth and development of our kiddies, the airway. Many a times, the parents come in they don't know whether the child breathes through their mouth or breathes through their nose habitually. I think this is a very important first step that we will need to stress on and to observe on our children. All right? Mouth breathing or nasal breathing or breathing through the nose, which is normal and which is correct. Today, dysfunction is the new function. And that's a very, very common thing that's happening amongst our children now. I might sound a bit silly talking about this, but the nose is designed to breathe. The mouth is to chew, taste, and speak, not the other way around. So parents out there with young children, how many of your kids are actually suffering from sinus issues, They wake up in the morning with blocked nose, for example, sniffling, getting a cough every other week when they go to school. So think about it. I think it's time to pay attention. And how is it going to impact on their growth and development? I'm going to share with you in the coming slides. So the airway. One of the common issues here is mouth breathing. And if a child mouth breathes, they might get or experience frequent cough, throat infection, for example. Of course, dry mouth. And many of them, as you can see in the photograph here, have enlarged adenoids and tonsils. This affects the airway and the way they breathe. Tongue posture or the condition of the tongue can also affect that as well. For example, and very common we see is tongue tie and lip tie, as you can see in the photos there. And in the videos, you can see as a child who has a short tongue and the tongue tie situation, and at the same time also has enlarged tonsils and adenoids. So you can understand why she is a mouth breather. The other child on braces, she actually swallows with a tongue thrust. This means that when she swallows, you can see that right now, the tongue pushes forward when she swallows. All right, this is a bad habit, or it's not a habit that can be, it's a habit that can be corrected. However, this habit is developed during infancy. All right. Very common nowadays, we are the 低头族, right? They're holding on the handphones and everything. Look at the posture of these children, right? However, mouth breathing can also lead to a forward head posture, all right, which then may lead to other physical ailments or postural issues. Sleep will then be affected, especially if you're blocked, the child's nose is blocked, be it a child or an adult actually. Snoring, restless sleep, and as a result of that, fatigue during the day. Parents always notice my child grinds. I can hear the child's grinding across the room. All right. Sleep apnea and UARS, I will talk a little bit more later on. With all this, because the child is not getting the elixir of life, oxygen, growth and development of the child may be affected. All right. It might lead to attention issues in school, and jaw development and growth may also be affected, and as a result of that, crowding of the teeth, and of course the smile gets affected. But that's actually a small inconvenience, all right? However, the growth and development of the child is the key thing, especially during these developmental times, important times, right? So it's not just the dentist who takes care of that. The dentist identifies that because we see the child for regular 6-monthly checkups and clean. However, it's a team management, and sometimes a lot of times we work with the team of medical specialists, for example, the ENTs, pediatricians, sleep physicians even. And in infants, lactating specialists, especially when they are having problems or challenges, breastfeeding, for example. Speech therapy, as I mentioned just now, anyone with lip tie or tongue tie could lead to speech that's not clear, all right? Osteopaths and physiotherapists due to postural issues, and of course, dentists. Myofunctional therapy is a technique or a therapy that can help to train the muscles to be working correctly. As the word suggests, myo is muscle, and function is the way the muscle functions. The whole purpose of this is to achieve nasal breathing through the nose 24/7. I give you examples of this 7-year-old Brazilian child. The parents have put this child through tonsils removal and adenoids removal when him and his brother was 5-6 years old. All right, this is him as he presents at 7. Okay, what you can see here, of course, is a developing dentition. You have a mix of permanent and baby teeth. However, you can see very clearly the very deep bite between the upper and lower jaws. And what you can also see on the screen on the right is a very deep and high upper jaw, the palate. And the lower front teeth, as the permanent teeth erupts, you can also start to visualize the crowding because there's not enough parking space for the larger teeth. The jaw is just too small. All right. We put the child, the two brothers, through myofunctional therapy. There are exercises that we do. As we say, this is almost like physiotherapy, all right? They train the lips, train the muscles, train the tongue, train the swallowing muscles, and train to breathe through the nose 24/7. And with that, what you can see over the course of 14, 15 months, you can see that the jaw, the bite has developed quite nicely, as you can see from the lower, the bite in the front teeth. The cleaning as a boy, typical boy, he's still not cleaning very well, all right? But the bite has developed nicely. You can also see that the lower front teeth and the arch, the teeth are fitting in nicely as well. Of course, for this boy, the teeth are still developing, not the whole set of permanent teeth are in there, but we are creating the stage so that the rest of the permanent teeth can come in a much better position, okay? This is an 8-year-old girl. This is the child that you can see. The first impression is, don't you see that the tongue is quite large for a small girl, right? What she's demonstrating to you now, you can see on the video, is her tongue tie. So you can do all sorts of acrobatics with the tongue, which if I look at it, my tongue will cramp if I try to do all that, all right? You look at the tongue as a tie. You can also observe the enlarged adenoids and tonsils, all right? The child did not go through the removal, or the TNA as we call it, all right? You can see the crowded upper and lower front teeth, all right? Especially the lower front teeth, there's now permanent teeth that's now erupting. However, we still put the child through myofunctional therapy, and you can see that there is a general enlargement or guidance or growth of the lower jaw. That's the most obvious that you can see on the screen on the lower right side. The lower front teeth, we managed to get them to align, and this is not through braces. This is just through muscle activities, through training, the correct activity, correct positioning of the tongue, and breathing through the nose, okay? However, there is still a limitation as to what this therapy can do, because it helps to guide the growth of the jaw, present the muscles in the correct position. However, in this case, the child still has to go through and is now going through orthodontics, which is alignment of her teeth. As she is now older, the permanent teeth has come out. We can help her to align. In this case, she did not need to extract her teeth at all. Many of us who've been through braces last time, we had to remove our teeth because there's just not enough space. In this case, with the therapy, we were able to achieve that, getting the teeth straightened without any extraction. So you can look at it as an example, as a strategy to simplify treatment for the child. So Professor Christian Guilleminot, he's actually the father of sleep dentistry, if you call it, all right? And this study that he has put out indicated that myofunctional therapy, the aims of it is to achieve continuous nasal or nose breathing during awake as well as during sleep. That's the ultimate goal, all right? And with that, there will be correct breathing, swallowing, chewing, and speech, all right? And with that, correct posture, fringe benefit, straighter teeth. Now, the father of sleep dentistry also is the one who coined sleep apnea, obstructed sleep apnea, and UARS, upper airway respiratory syndrome. This occurs in many adults, even children nowadays, all right? And this basically what happens is the patient actually chokes during sleep, all right? Resulting in oxygen desaturation and sleep fragmentation. Sleep becomes poor. And over time, you get cardiovascular issues, you get neurocognitive issues. One layman term is mind fog. You know, you wake up, you need 20 minutes to clear that fog, all right? And other medical issues along the way over time. As we move on to our older patients, let me give you and share with you some of the conditions that the patients present with. This patient is a 46-year-old female lawyer. She came in unhappy and want to correct the gaps between her teeth, we can see, right? The natural thing to do is, let's go for braces and close up the gaps, all right? However, we need to investigate what caused these gaps. These gaps opened up slowly over the course of 10, 15 years. So what caused this? As she opened her mouth, what do you see? Tongue. Tongue and nothing but the tongue. So with the size of the tongue and the small mouth and possibly small airway, I think she may be having some issues breathing. Not when she's awake, but probably when she's asleep. So we did some investigations. This is called a sleep study. This is a report after the sleep study. A lot of information, a lot of numbers there, but I'll bring you to attention of AHI, all right? Her AHI, somewhere in there, the AHI is 33.1, all right? That's severe, okay? And if you look to the right side, I'll bring you to the snore and body position. What you see in orange, it's a snoring, all right? And many of us snore. I snore especially as well, especially if I drink alcohol. My wife will not be very pleased with me because she cannot sleep very well because I snore, all right? But this is potentially a health and medical issue. So a sleep study will give us a lot of information. AHI is one. Oxygen desaturation is another. In her case, her desat is about 85%, 86%. And everyone knows now with COVID going on, when we measure our oxygen with the pulse oximeter, anything below 90, better go to the doctor, right? This patient consistently every night, she hits 86% for a certain time of the night during her sleep. So she is well during the day, I always say, but she's very sick in the night when she's sleeping. Further data that gives us information from the sleep study. As you can see on the lower right side, her AHI is 33. That's severe. All right? You ask her how her sleep is, she will tell you, my sleep is good. I sleep well. I know I snore, but I sleep well. Honestly, she's very sick in the night when she's sleeping. And she has started, at the time that we were talking about it, she started getting heart palpitations, all right, and cardiac issues during the day as well. So we referred her to the cardiologist, who then referred her to the ENT for management. And prescription was she's on the CPAP, okay, and she's feeling much better. But of course, we have to put on hold closing of the spaces of the teeth. But in this case, we managed to locate or identify her medical condition. All right. So what you see on the lower right side, these are the CPAP that patients has to wear. She has to put on to help her breathe, to give her oxygen during sleep. And on the left, that's a sleep device that dentists can fabricate for you to help to maintain the airway during sleep as well. And a lot of times we work hand in hand with the sleep physician, the ENTs, to manage these patients. A little bit of a trivial. If you look at this, I was mentioning about the body position and the snore. The orange that you see looks like an earthquake happening, all right? And if you look at it, she goes to 70 decibels at the maximum. And the little table below, you will see 70 decibels is almost like a vacuum cleaner. So imagine sleeping next to a person with the vacuum cleaner on or the hairdryer on next to your ears, all right? It will not be very pleasant. But this is a social issue, all right? A little bit more information pertaining to the Singaporean population. This is a landmark study done in 2012, all right? To drill down, racial distribution, 33%, or 1/3, 1 in 3 of Chinese, 1 in 3 of Malays, and 1 in 6 of Indians are diagnosed with moderately severe sleep disordered breathing, okay? And the unfortunate thing is 90% of them go undiagnosed, all right? So you can see that in our population, it can be a real risk situation over time, okay? Because over time, as we get older, the risk of cardiac issues, stroke, diabetes, and all metabolic issues may start to arise. Let's move on. Another patient. So I don't know why I have many lawyer patients, but this 38-year-old lawyer patient of mine, midlife crisis. right? Presented to me with a blunt injury. He lost his 2 lower front teeth. Guess what he was doing? 300 horsepower car don't want. Went to buy a 1 horsepower horse. Went horse riding and was playing polo. He got hit by a polo club. All right? So this is him. He lost his 2 lower front teeth, deep lacerations on the lip. I asked him, hey, since you're in the hospital, why don't you go and call a plastic surgeon and get yourself stitched up first before you come and see me? He said, no, I'd rather you take care of me. So dealing with a patient, having to stitch up his lips, all right, clean up, stitch up his lips and deal with his dental issues, it's a little bit stressful, okay? But anyway, we took care of him. Let me just share his journey, all right? As with any injuries in the dental region, we close him up, layered suturing, right? Quite proud of myself with how he has healed up, all right? And we gave him a set of temporaries, all right? What you see there is a temporary bridge, okay? That as he heals, he's not going to go out to the courts or meeting clients with 2 missing front teeth. It's just not done, right? After we stabilized him, we did bone grafting, all right? As you can see, day 0 is the day of the injury. You can see how the jawbone with the missing teeth has just basically split, all right? There's no bone there, and we have to develop that bone and graft that bone back. And on the right side, you can see an implant that's placed in that will help us support the bridge eventually. So after 6 months of treatment time with him being cleaned up and stitched up, bone graft, temporary, and with implants and the crowns done or bridge done, this is what you see in his final results, okay? So this is almost about 8 years already, and he hasn't called me yet, so I'm quite glad. Another patient, a male, he was a triathlete, and he came in saying that, hey, it's my 50th birthday coming up. I'm not happy with my smile. I'd like to get a new smile. Smile makeover, or we call it smile enhancement, okay? How did he get there? He's just a 50-year-old chap, right? How did he get there? Look at all this wear and erosion and everything, okay? Firstly, he's not happy that when he's not smiling, he looks like he bogey, right? When he smiles, he shows some really short teeth. So that's one thing he's not happy with. Next thing he's not happy with is his uneven teeth, uneven smile, all right? Over the years, he had some crowns that's done, as you can see on the lower right side of the screen. And on the top, some fillings, all right? These are metal fillings. But what you can really see is the wear that's caused by grinding, all right? You can also see a lot of erosion, okay? You see the teeth are very glossy and yellow. Basically, acid from his diet has eaten away the external layer of the teeth, and you're showing the yellow on the inside, okay? So one of the reasons after interviewing with him and talking to him is he has a habit of biting his nails. If you look at it, he's got no nails. The nails are all the way to the nail bed, all right? And this may also be one of the reasons why he caused the wear on his teeth. But coming back to diet, remember we were talking about him being a triathlete. As he trains, as he does his bicycling and everything, he relies a lot of isotonic drinks. He relies a lot of energy gels, and he sucks on them as he cycles, for example. And where he places on the side of his front teeth. With that, the acidity dissolves, basically, eroded away the external layer of his teeth. That's why you look at the 2 front teeth looks okay. The teeth on the side basically eroded away. So we need to manage some of these habits. We need to manage some of this lifestyle, and definitely need to manage some of these bad habits of nail biting, for example, because whatever we do for him is just going to break away if he doesn't change his lifestyle, change the diet, all right, and whatsoever. So we went through a plan, 3D design digitally, come up with the plan, show it to him. We did a mock-up, as you see in the center of the screen, show him what sort of results we want to achieve for him, or we potentially can achieve for him. And he gave the go-ahead, and we gave him the veneers. So he had veneers done, okay? These veneers are not just purely for aesthetic reasons. This also helps to protect the rest of the teeth and his dentition from further breakdown, even as he continues with his activities and his lifestyle. All right. So as you can see here, from the left, when we first started the journey with him, to the right, as we finished his smile enhancement or smile makeover, he went through 6 porcelain veneers, 8 porcelain onlays, all on the upper teeth, teeth whitening, all right, on the lower teeth, treatment time of 2 months. Okay. This was almost, again, about 7 years ago, and I think he is now relocated back to Australia. No emails or calls from him at this point. I guess he's a happy camper. Next, I'd like to share with you another patient of mine, now in a 48-year-old executive, male, unhappy with his smile because he finds that the teeth are too short and the gums are uneven. So if you look at that, the yellow lines, uneven, short teeth, and the gums between this left side and his right side is of a different level. So when he smiles, his smile is lopsided. Okay, of course, then you can see uneven alignment of the teeth. So what did we put him through? We put him through braces to align the gum level. All right. After that, after the gum levels are aligned, we did veneers for him. The braces took 15 months, I apologize. All right. After that, we did veneers for him. And from start to end, with teeth whitening and just 4 porcelain veneers on the front, we didn't need the entire mouth being treated, right? And we are able to achieve a nice smile for him. Is it a Hollywood smile? He doesn't need a Hollywood smile. So it's conservative and at the same time, long-lasting, all right? So a total of 16 months of treatment because of the orthodontics or the braces that he had to go through. Now, finally, I bring you to this Australian patient, a 42-year-old IT director. All right, he came in not happy with his very narrow smile. When he smiles, he has a lot of gaps between his cheeks and his teeth. He wanted almost like a Julia Roberts kind of smile. He wants a wide smile. Okay, for those of us who are old enough to know Julia Roberts, yeah. She has a really wide and dazzling smile. So he's not happy with his short teeth and small teeth as well. And look at his deep bite. By now, everyone knows how to identify a deep bite. You can't see his lower front teeth, all right? So what did we plan for him? Smile enhancement. We went through a period of 8 months of aligner. This is like braces, but using aligners. All right, clear aligners to go through. So you can see those little stubs that's placed on his teeth. These are akin to the brackets that in the regular braces. And with a series of clear aligners, they help to straighten his teeth and move his teeth to a better position so that we can get veneers done for him. And with this combination of technique from technology with aligners and veneers, we are able to achieve this in 8-9 months. Okay, so as I was saying, 10 veneers on the top. After we've aligned the teeth to a better position, we went through teeth whitening, especially for the lower, to get the teeth brighter. Total of 9 months, we are able to achieve, I would say in this case, a pretty decent Hollywood smile. Although he's not in Hollywood, he's probably in Sydney now, all right? For the patient, and this is going to last a long time for him. And these are predictable solutions for him. All right. So I hope that in the last 30 minutes or so, I've been able to share with you how the dentist can give you that dental wellness with smile, so that you can smile with confidence through smile enhancement. How it's important that you're able to eat well with the work that we do, especially for our children. Sleep is also an important thing. And the airway, to get the airway so you can breathe properly through the nose during sleep is also critical. And for our little ones, our little darlings, they, with the elixir of air of life, which is oxygen, they can grow well. And we can achieve that using myofunctional therapy. So I thank you for your attention.